estimate how many missed cases, how many Rift Valley fever cases we miss in the Ugandan context. Just to give a preamble, the first confirmed case for Uganda was in 2016. And since then, we have kept having epidemics, outbreaks from time to time. But the government doesn't yet feel that RVF is a burden, and therefore they should give it attention that it deserves. So in Kenya and in Tanzania, there is vaccination that goes on a private arrangement with the farmers for the livestock. So far, we don't have a licensed vaccine for humans. However, in Uganda, the policymakers haven't yet felt there is enough evidence for them to roll out vaccination. So what we did, we adapted the existing StarSim. So this is teasing me a bit. Yeah. So what we did, we adapted the existing StarSim, which was developed by the IDM team here. And so we built the SIS model to be able to simulate the infections for this Rift Valley fever disease. And like I mentioned earlier, we had access to livestock movement data. This is data which cattle are moved from one subnational level, one district to the other, but also we got access to climate data, but also animal census data, which was done last year by the government of Uganda. We got a lot of surveillance data from the Ministry of Agriculture. Something to note is that I'm also doing my PhD on Rift Valley fever, so I had the privilege to get more insights, but also more data that we are working on for the PhD work. Sorry about that. Just to give us a bit of assumptions that we built in, like I mentioned earlier, the virus, there is a mosquito component in the transmission of this disease, but also the human contact, if they get in contact with the humans. So in building the ABM, we built agents, but also we looked at climatic conditions, specifically rainfall and temperature. But also we looked at the dynamic network for cattle movement from one district to the other. Later on, we tried to simulate an intervention of testing, because right now the government only tests when there is a confirmed outbreak in humans. That's when they test animals. And we think that shouldn't be the case because the disease spreads from animals to humans. So we felt that the testing should be done in animals first, and that's the case we are trying to make. So as intervention, we simulated for potential testing if it is done and what benefits it would give us. So these are the preliminary results. We are in close communication with the Ministry of Agriculture in Uganda. We are presenting these results 2 weeks from now to them so they can validate them, but also give us access to more data and we can calibrate our model better. So these are the results that we are seeing. Something I didn't note is that this disease is highly asymptomatic, and so many cases go unnoticed. And that is why we think that there should be syndromic surveillance established for us to detect these cases that go on. So this is just the initial conditions. We are seeing that we miss up to 92% of the cases. But if we intervened and began testing, we think that we can be able to detect some cases, but we shall miss 73% of the cases. Now that means that we need to set up a surveillance system for us to be able to detect Rift Valley fever because of the implications that it has. These are some of the insights in terms of next steps, but also we point out some strengths and limitations from our work. Sorry about that. The computer is failing. Yeah. Thank you so much for listening, and happy to get insights, but also chat more during the coffee to tell you more about this disease. Thank you so much for listening.